And Dr. Zambanis, as Dr. Perlman just mentioned, there is a lot of that. This issue has been so politicized, and well, in my opinion, a lot of people around the world, much of the public have been very conflicted about the messaging that they've been getting from their governments and authorities, different authorities. So how do you think the public messaging really should be in terms of really preparing the members of public for a possible second or even third waves and going forward?
Yeah, health authorities will base their decisions on a metric called the reproduction factor. This is how many people on average one person with the disease will infect. The basic rate of infection of COVID-19 is a theoretical number that is calculated in combination of daily real-world data and simulation models that predict the spread of the pandemic. So the disease is dynamic and affected by all these other external factors. And the one thing important to note is that most health authorities is also dependent on hospital capacity. However, without widespread testing, you risk health system to be eventually overburdened and avoidable deaths to occur. So everyone needs to be pretty cautious the way we approach this. And so mathematical models and their simulations can be used by governments to determine what interventions and policies they should implement. But simulations can measure the impact of the intervention and compare it to interventions or how the timing of the introduction affects the outcome. But also governments must make massive investments in contact tracing, which tries to stop the chain of transmission by identifying those individuals who need to self-isolate and reduce that spread of the contagion.